Here's a number that deserves attention. Large population research has shown that roughly half of men between 40 and 70 report some degree of erectile difficulty, and urinary symptoms from an enlarged prostate become more common with age. Those are not rare edge cases, they're everyday realities. Today we're going to look at pumpkin seeds as a food ally for erectile function, prostate comfort, and hormonal health. We'll be clear on what the science actually supports, where the limits are, and how to use them safely as part of a broader plan. I translate health research into practical language, and everything here is based on real studies and reputable organizations. This is educational content and does not replace care with your clinician. Let's start with what's inside these little seeds that matters for men. Pumpkin seed kernels deliver a meaningful mix of zinc, magnesium, arginine, healthy unsaturated fats, and plant sterols. Zinc concentrates in the prostate and seminal fluid and participates in testosterone production and spermatogenesis. Being low in zinc can impair these processes, and restoring sufficiency can help. Magnesium supports vascular tone, glucose control, and muscle relaxation, terrain that affects erections and nighttime urination. Arginine is a nitric oxide precursor. Nitric oxide is the tiny messenger that tells penile blood vessels to relax during arousal. Plant sterols are relevant because standardized pumpkin seed oils and extracts that retain them have shown modest, clinically measurable benefits for urinary symptoms in some trials. For erections, think blood flow biology. Nitric oxide is the on switch. Clinical trials using L-arginine supplements, again, supplements, not food alone, have shown modest improvements in mild to moderate erectile dysfunction, reflected in better scores on validated questionnaires and improved penile blood flow measures. That doesn't mean a handful of seeds will act like a pill. It does tell us the pathway is tunable, and diet can support that pathway when you also work on the big levers: aerobic fitness, sleep, blood pressure, glucose control, and stress. Diets that support endothelial function, more plants, fish, legumes, nuts, and seeds, fewer ultra-processed foods, are consistently associated with better vascular health, and erectile function follows vascular health more than most people realize. Now the prostate. Research on pumpkin seed in men largely uses oil or standardized extracts of cucurbita pepo. In randomized clinical trials, men with benign prostatic hyperplasia who took pumpkin seed oil reported reductions in symptom scores on the International Prostate Symptom Score. The oil was generally less potent than alpha blocker medication like tamsulosin, but it still produced symptom relief for some participants and was well tolerated. Studies in overactive bladder suggest benefits for urgency and frequency with certain extracts, though the samples are small and product formulas vary. The fair takeaway is that standardized pumpkin seed preparations can provide adjunct relief with a good safety profile, but they are not standalone cures, and results differ by dose, extract composition, and baseline symptoms. Whole seeds are the foundational food version. They deliver the building blocks and align with a urinary and heart-healthy eating pattern, but they won't deliver an extract's exact milligram dose of bioactives. Testicles and hormones deserve an honest, evidence-based update too. Zinc status matters for testosterone synthesis and healthy sperm development. Reviews in andrology emphasize that deficiency is linked to reduced testosterone, poorer semen parameters, and testicular changes, and that correcting deficiency can improve those markers. But more is not always better. A large randomized trial in men undergoing infertility care found that daily zinc plus folic acid did not improve semen quality or live birth rates compared with placebo. That tells us two things. Food. First is a safe default to achieve adequacy, and targeted supplementation should be guided by testing and clinical advice rather than guesswork. So, how do you use pumpkin seeds safely and in a way that actually helps? Keep it simple and consistent. A practical daily portion is about 1 ounce of unsalted kernels, a small handful. That keeps calories reasonable while contributing zinc and magnesium, plus fiber, arginine, and healthy fats. Fold them into what you already eat, scattered over yogurt or oats, blended into a pesto with olive oil and herbs, mixed into a salad or soup, or added to a whole grain bowl. Pairing seeds with meals smooths glucose responses and increases satiety, which indirectly benefits vascular health and blood pressure over time. Let's make this actionable with clear checkpoints you can track. First, erections work like a vascular stress test, so I want you to monitor the terrain. Each morning for a week, grade your morning erections on a 0 to 5 scale. At night, write down the number of bathroom trips, 0, 1, 2, plus, any urgency, hesitancy, weak stream, or dribbling. If you suspect prostate-related symptoms, you can also complete the International Prostate Symptom Score at home and bring the number to your clinician. That's the same tool many studies use to measure progress. Data you collect about your own body will beat vague impressions every time. Second, align the seeds with a small routine upgrade for blood flow. A brisk 20-minute walk most days and a 2 to 3 day per week resistance routine are the best partners for foods that support nitric oxide biology. Sleep 7 to 8 hours on a consistent schedule if you can. Sleep deprivation sabotages testosterone and endothelial function. Keep alcohol modest, especially late in the evening. It worsens nocturia for many men. Third, be realistic about what food can achieve and when to escalate care. If nighttime urination and urgency remain unchanged and bothersome after a few weeks, or if erections are consistently poor despite lifestyle upgrades, book an appointment. Medications for lower urinary tract symptoms, like alpha blockers, and for erectile dysfunction, like PDE5 inhibitors, often provide meaningful relief. Diet and lifestyle should be complementary to, not replacements for, evidence-based therapies. There are some important safety notes. Go unsalted whenever possible. It's easy to overshoot sodium and calories with salty mixes. If you have a known seed allergy, irritable bowel symptoms that flare with higher fiber, diabetes managed with insulin or secretagogues, or moderate to severe urinary symptoms, especially urinary retention, blood in the urine, or pain, involve your clinician before changing your diet. Don't stop prescribed medication because you added a food, and please don't megadose zinc. Reputable nutrition sources warn that excess zinc can cause nausea, reduce copper absorption, and impair immune function. Food first and lab-guided supplementation are safer than guessing. A quick clarity check on expectations. Pumpkin seeds are not a testosterone booster for men who already have normal testosterone. They can help you reach or maintain adequate zinc intake and add nutrients tied to vascular and urinary health. If you are zinc deficient, addressing that deficiency can improve reproductive markers. If you are sufficient, adding more zinc will not necessarily raise testosterone or improve semen quality. For erections, the biggest wins usually come from the boring fundamentals: blood pressure in range, A1C, and fasting glucose controlled, waist circumference trending down, and regular exercise that keeps the endothelium responsive. Seeds support that ecosystem. They do not replace it. If you want a simple day one plan, here it is. Step 1. Today, add a measured small handful of unsalted pumpkin seed kernels to your lunch or afternoon snack. Step 2. Walk for 20 minutes at a pace that makes conversation a little breathless and get lights out at the same time tonight. Step 3. Start a 7-day log with 3 lines: morning erections, 0 to 5, nighttime bathroom trips, and a note about stream strength or urgency. After a week, look at the data. If you're seeing 0 to 1 morning erections most days, or 2 or more nighttime trips consistently, or worrisome urinary changes, schedule a check-in with your clinician and bring your log. That conversation, anchored in your own numbers, is far more productive than "it feels a bit worse." What about oils and extracts? If your clinician recommends a standardized pumpkin seed oil or extract for urinary symptoms, understand that those formulas concentrate certain compounds that are thought to act on bladder and prostate physiology. Trials show modest benefits with good tolerability. Results vary by dose and product. Whole seeds remain a smart, food-level foundation, whether or not you use an extract. Let's shut down a couple of myths before we wrap. No, pumpkin seeds don't cure erectile dysfunction caused by nerve damage, advanced atherosclerosis, or medication side effects. They are also not a standalone therapy for significant prostate enlargement. They are, however, a simple, tasty, and nutrient-dense habit that makes sense inside a medical plan. And because they live in your pantry, they help you practice your plan daily, one measured handful at a time. Here's a fast recap you can screenshot. Nutrients that matter: zinc, magnesium, arginine, phytosterols. Functions that matter: nitric oxide and blood flow, urinary comfort, hormonal sufficiency. And behaviors that matter: measured portion, consistent movement, steady sleep, smart medical escalation. Notice early, act early, and you may protect years of energy, intimacy, and presence with the people you love. If this helped, tell me in the comments whether you already use pumpkin seeds or how you plan to add them today. Share this with a friend who gets up at night more than once, and subscribe so you don't miss upcoming videos on sleep, weight, and sexual health. Information guides. Decisions are made with your health professional.